Welcome to the third lecture in the series of General Psychology course. So today we're going to talk about stress, coping, and health, and how they are all interconnected. What we need to look and understand here is that you will have a patient who will come to have a blood test, and this is specific to you here, MLS guys. So you have a patient who comes to have a blood test. Now, most patients don't like to be injected with a sharp needle, especially children. So let's talk about it again. So you have a patient here, and they are going to have stress. So we need to see what we can do to help them cope with this stress. And this is the understanding we will get out of this lecture. And what effects does stress have on health, on your health, on the patient's health? Now, the patients need to be reassured and need to be treated with dignity so they can accept the uncomfortable feeling of having a needle stabbed into their arm or someone else. So, what is stress in the first place? What is stress? Let's first of all understand what stress is. And stress can be a physical or psychological response to an internal or external pressure. So, let me explain here. Now, physical response would be by increasing the heart rate or blood pressure or getting red face. Have you seen people under stress with red face? Have you seen people who are going to do something that is very stressful to them and they are sweating like crazy? So this is a physical response. Now the psychological response is inside, and the inside is what sometimes affects the outside, so internal and external. Stresses are the causes of stress. So there is something that causes stress. Me coming with a needle to you, or you going to speak publicly, right? That's also a stress. There's a lot of other stresses as well in life, but these are examples of that. So in the past, and actually probably still here in Kurdistan, disease is organic. It's an infection by a virus. You break your arm. It's an organic disease. You have an infection, a tooth infection, or an infection somewhere else in your body, a cyst, something physical, organic. And that is a disease. But now we know, and slowly in Kurdistan as well, we're starting to understand that psychological disorders also can be as effective as a disease to the body as a physical disease. And now, in the 20th century, last century, these things have started to become recognized slowly. Now, in the 80s and 90s, become more recognized in the West, but less here. And I think we are slowly getting onto that bandwagon because we do know and we do see effects of that. I personally, as a doctor, as a surgeon, I do see a lot of patients who have physical symptoms, real physical symptoms that are actually a response to a psychological effect. So they go to 10 doctors, they get XYZ checked, seen, investigated, CT scan, X-ray, God knows what else. But at the end, they don't have a cure because sometimes the cure is psychological. When you treat the psychology, I actually had 2 days ago exactly that. I had a patient who came from Kirkuk and he had a real physical problem. And his real physical problem was he had abdominal pain, so tummy pain, and headaches, and eye ache, ear ache. There was a lot of pain around and toothache. And upon investigating with this patient, there was a problem. And this all started some months ago. And that was after he had a massive problem with a woman he married. But he didn't work out. So he got separated and he divorced his wife. But there seemed to have been a problem there, a significant problem. He didn't tell me the whole story, but I could see it and its effect on his body. So as I said, stress here can be internal, it could be external, and it could be chronic. Let me explain this here. So internal is something inside you, something ongoing in your mind. External is when there is a stress from outside, the needle, for example, or me threatening you or shouting at you, or you going to speak publicly, so you have an external effect from outside. But there's also chronic stress. Chronic stress is people who are stressed like all the time. Ask your mothers. A lot of mothers are just stressed by default every day. They are stressed because of you going out, because of you coming back, because of you seeing that, because of you going to the restaurant. Mother's job is to be stressed, I think. So in this country, definitely. So we have chronic stress that is ongoing. A relationship you have that is not working out, and that can be external or internal. So it's not either or that. You have internal from inside, you've got external, but you've got the chronic one. So you could short-term stress. Me with a needle is short-term. Once the needle business has finished, the stress finishes. And you see, they have, it's kind of like the shoulders are up and they're very stressed. And when everything finishes, the shoulders come down and they're relaxed. Moreover, I have also patients where we treat them because of their stress with tranquilizers. So we make them relaxed. They are still stressed. And funny thing is, once you finish with your job, and we talk about children here mainly, they fall asleep immediately. They just fall asleep because the stress has gone and they relax. Stress. The stress and its response. And the responses can be either the fight or flight response. The fight is that you go for it, and the flight is you run away from it. It could be emotional response, or it could be physiological. Emotional, you get sad, you go in, you put it all in, with a possibility that it might show up physiologically and physically later on. Could be also a response to an emergency. An emergency is, for example, if a dog is running towards you, a big dog, and so you get stressed, so you might decide to run. That's the flight. Or you might decide you want to fight the dog. Okay? So what's its effect? The physiological effect is that when you have stress, is that the brain... Sorry, that was my phone. Right, so the response from the brain is that there is a signal to adrenal glands. Adrenal glands is the glands that produce the adrenaline and noradrenaline hormones, adrenal glands, right? They are around the kidneys. So these are the glands that produce adrenaline and noradrenaline. And let's think about adrenaline. What does adrenaline do? The effect from there is all of this. Adrenaline accelerates the heart rate, makes the muscles tense. Because it's the other way around, because you want blood as much as possible to the muscles here, you do not need digestion around that time. So it slows down the digestion. It's anti that. Now we need energy, so it goes to the liver and converts glycogen to glucose. We need glucose free in the body because we need it for the muscles, for the heart, for the lungs. And because we need more sugar and more energy, we need oxygen for its consumption and use. We need oxygen to convert glucose to energy within the so-called Krebs cycle. So the heart accelerates rate and the blood pressure, muscles get tense, stomach slows down. Sorry again. My secretary seems to like to call me today a lot. Okay, so we get fast breathing in the lungs to get more oxygen into the body, glucose to pump energy, supplements the glucose, right? All this is started by the adrenaline. Now, as I said, while you're all doing this and you're trying to do the fight or flight, which means you need energy for it, you do not need digestion, so that slows down. You do not need a lot of other things. What else happens is that we notice that the hair gets erected. So your hair goes like this. And if you look at the arms, sometimes you get, if you have a bit of hair, so when you're stressed, you get that kind of like goosebumps. Interestingly, when you're stressed, your bladder relaxes and you want to go to the toilet. Interestingly. So you feel, if you're stressed, if you think about it frequently, you have an urge, more urge to go to the toilet because of that effect and relaxing effect on the bladder. And in the eyes, you get constriction. So the pupil constricts and you get tunnel vision. Okay, so you don't see a lot on the periphery. If you remember, if you think about it, when you have all that stress, you don't see here things at the edges, and you concentrate on the tunnel vision. So what happens is that sometimes things happen on the vert, on the side, but you don't see that. You physically don't see that because your eye is concentrating on the front side. Let's look at the stress itself. There is also a distinction between not only internal, external, and chronic, but also on major stress versus daily stress. Now, daily stress is, for example, you going out and waiting 2 minutes for the lift, or because it makes you late, or you go into your car and you remember that you haven't put petrol in it and it's got little petrol. So daily small things. Hot weather makes you a little bit stressed sometimes. The traffic outside, especially with the funny traffic we have in Kurdistan, only God knows who's what. So that could be the daily stress. The major stress is, God forbid, you discover you have cancer, or one of your relatives or parents have something big, heart attack, big events, or you're getting divorced, or your parents getting divorced, or someone close to you getting divorced, that has an effect on you, or also financial problems. Financial problems are, for example, is you or the family getting into financial trouble. One salary every 6 months, well, that isn't helping. That will give you stress. You think about it, I need to pay my Komar university fees, but I don't have money. Why don't I have money? Because my parents are not getting their salaries on time. So that is stress. And that is not just a daily stress, a small stress, that is a major stress that can cause some serious effects. Anxious, neurotic people experience more stress and their threshold is lower. There are people who are simply too easy to get stressed. And there are people who are just cool. You may drop an atomic bomb on Baghdad and they could still just be relaxed. You may see that there is a major problem and they're still relaxed. You may have it naturally, but you may also learn it. And there's a lot of courses where it teaches you to have internal peace. Today, someone told me today, be like a water bottle. And the question is, what do you mean with that? Not like a soda. So if the world shakes you, you will not explode when you open the bottle, but you will still be calm, because still water, nothing happens to it. But if it's a soda, it will just explode. So you need sometimes to learn through meditation, through courses or books, or learning how to do it, is to learn how to calm yourself. And feeling stress is dependent on cognition. Now, there is a saying, for example, that actually more women are stressed in marriages than men, because this is not serious. This is just a kind of like a joke, is that men just don't have the cognition of women, and so they don't feel stress as much as women. That's not serious, okay? This is a joke. So there is a difference in everyone, in genders, and every different person is how they perceive stress and how they react to it. And you can learn how to modify your reaction to it. So if you go on, let's say you are in a concert and this is your first time you're going to sing with a big band. For example, let's say One Direction comes back and they have their first concert and you are invited to be with them as a guest. Now you can expect, I mean, the likelihood of this happening is very low, of course, but nevertheless it can happen, is that you will have a lot of stress. But One Direction are professionals. They've been doing it for so many years that they have learned to cope and perceive less destructive stress during these concerts. So professionals get taught to lower their stress. And so concert singers get special teaching. Adele was one of those that couldn't do concerts. She had serious fear, but then she was taught how to overcome that fear and be able to do concerts. She wouldn't do concerts initially. So major, daily, internal, external, and chronic. Now we come to acute and chronic. Now acute is short, now, the needle, think about it. Or you're driving and boom, you get a flash from a camera. So I have now a fine, 70, 80,000 dinars I need to pay. It's acute, but after 5 minutes, well, that's life. Or you might think about it a little bit more, but it's acute. Coronavirus, it's acute, it's now. It wasn't here 2 years ago, it wasn't here last year, and maybe in 5 years' time, we may not have it, we don't know. But it's acute for now. Now, acute can be hours, short, minutes, days, within a certain period. Chronic, on the other side, is a long duration, it's ongoing. Like if you have a job, or if you are studying something that you don't like and it's causing you stress, or if your lecturer is someone who likes to cause you stress, who does cause you stress. So that's chronic. The whole study, the whole job, your relationship. If you're married with someone, if there is a problem, that is a chronic stress. You could have financial problems. You have a loan, you have a loan to someone and you don't know how to pay them back and it is causing you stress. So let's talk about now the physiology of stress. You've already learned physiology. I'm sure that you've learned it, and you haven't learned it, you will learn it. Now, the central part of it, of the whole physiology of stress, is the adrenal glands, which are located above the kidneys. And this is, as I said in the other slide, that's where it starts, goes to here, and the whole thing follows that path. So what happens is that you have stress. The stress goes to the hypothalamus in the brain. And that goes and stimulates the pituitary gland, which is behind the nose in the brain. It's at the base of the skull. You can find it in all anatomy books. So the pituitary gland releases some hormone, and the hormone is ACTH or adrenocorticotropic hormone, adrenocorticotropic hormone, ACTH, which goes and stimulates the adrenal glands. So stress goes to brain, hypothalamus, goes to pituitary glands, and they give a hormone which goes to the adrenal glands, and that stimulates the adrenal glands. And that's where it starts. And we have now then adrenaline, noradrenaline, and cortisol as well. And these increase in blood. Okay? And that goes into the blood, and from the blood, it goes everywhere. It will have effect on the whole body because it gets distributed through the vascular system. Let's go back for a second and think about the parasympathetic and the sympathetic nervous systems. Now, adrenaline works on the sympathetic division, right? So it will accelerate and increase all of these. And it will be anti-parasympathetic. Parasympathetic is more acetylcholine. So it has effect on eyes, on the salivary glands. Now, when you're stressed, you will have a dry mouth. Have you noticed that? Because we need energy to the important part of the body. And the energy to the salivary glands are not important. You are not going to eat now while you're stressed, right? That's the idea of the flight and fright. So the idea with the system is that you have a lion coming to you. This is from the Neanderthal times. And you have to decide, am I going to fight or run? So the energy needs to go to the muscles, eyes, concentrate, and things like that. So the trachea and the bronchi, they dilate. So they dilate. Sympathetic dilates them. Heart, increase the blood pressure, so increase the pulse, and works on the vessels, which is not here, see, and it increases the tone of the muscles within the arteries, and that increases the blood pressure. Okay, on the liver, on the gallbladder, on the stomach, as I said, on the adrenaline glands here, that's where the whole thing comes. So this is where it comes from. If you see, these are out, 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 and this is where it comes from. This is where it is. Okay, on the gut as well. So there's no time to do any digestion at that time, and the urinary bladder. Right, so I'm sure that you've learned that in physiology. So basically, this is where stress will work. Coming on the types of stress you could also have. You could have pressure, bullying, someone at the university or school bullying you, causes you stress. How many people have committed suicide because of stress? Well, we know. Some people have financial stress, and it does have an effect. Some change. So the change from school to a school or school to university, it's a change. It will cause you stress, especially at the beginning. If there's a conflict, if you have a conflict with someone or someone in your near area, kind of in the surrounding area, as I said, sister has a problem with her husband, brother has a problem with someone, etc. And frustration as well. That is when you want to change something, but you are unable to change it. And you come to a stress that is caused by frustration. So your system comes to the state where you think, I can't do it anymore, frustrated. So it's the effect where you have kind of like the system is shutting down, is giving up. If you look at sports, and if you ask about winning, you'll find that that is something that they need always to eliminate, to forget about. The difference between winning in sports and high octane and high performance sports and professional sports is controlling the mind and being able to think positive and not to have negative effects. There was I think it was a arrow bow competitor. She in Tiru Kawan competition. And this person was in the Olympics. And this person was at the end, was going to win. And he says in his memoirs that in his mind, he was aiming for the last arrow. And something came in his mind that he may fail. What if he fails? What happens? And this was all going in his mind. And it went out and he lost. 4 years later, to the next Olympics, he trained his mind to concentrate that he will win. And he won the gold medal. So it's all here. The difference between his gold medal and his loss was that tiny bit of brain activity that distracted him. There was a video some years ago when the Iraqi football team won the Asian Cup. That was in 2000 and, let me think, 7, I think. 6 or 7, 7 probably, or 8. I can't remember very well, 7. It's exactly 2007. And they were playing outside because of all the trouble Baghdad had. The games were all played outside and the chances of them winning was very slim. But there was a video where the coach was coaching them to their psyche to prepare them to be strong in the game. And they went out and they won against a very strong team. And I think, if I'm not mistaken, it was Saudi Arabia. And Saudi Arabia has won multiple times the Asia Cup and other cups and have been to the World Cup. So Saudi is got a strong team and they did beat that team. It was here. Now let's come to the general adaptation syndrome. They did some experiments on rats and they exposed them to some stress. And they looked at some models of how can we stress rats. And they exposed them to stress and they noticed that the adrenal cortex, that around the kidneys, on top of kidneys, was enlarged. The lymph nodes were shrinking, immune system down, and they had stomach ulcers. Now, interestingly, humans, when they are under stress, they will have a weaker immune system. Frequently, they get stomach problems. Stress, we know, is a major contributor to stomach ulcers. And they have a lot of adrenaline going on in their body with cortisol. Adrenaline here and cortisol for the lymph nodes, because cortisol reduces the immune system. So the first thing is in the stages to the adaptation syndrome is that there's an alarm phase, there's the fight, so there is that acute phase. And then after that, there's the resistance phase. The body adapts, right? You start to adapt to that stress. And then you shut down unnecessary processes. So you start to have less hunger, digestion. Frequently, we see that you could lose weight or even your growth, if you're as a child, it will be reduced. You can see that the young teenagers who go into some of the psychological conditions, and we'll talk about it in a second, of the bulimia and such conditions, is that they are tiny, they are small frequently. You frequently, most of the time, see them that they're tiny, they're thin, and they're not kind of like big, tall ones usually. Even the sex drive is reduced in that phase. So if you speak to a lot of pairs, and we can do a study about that, but there are some studies already outside in Europe and the US where stress has reduced the sex drive as well. So it's all within that, and that's in the second stage where you get the resistance phase. And then you get the exhaustion phase, the third one. So when the body resistance collapses, you're more susceptible to infection, you may get tumors, And tumors, let's not forget that your body continuously makes tumors, but our immune system destroys it all the time. So if your immune system is low, what happens is that there is a higher chance of a tumor growing. And we know from a lot of studies, and we know from what we see, is that even when you have a tumor, those who are positive, who are energetic, frequently, but not all the time, are more able to fight their disease and stronger. And those who are giving up early, they die sooner, even at less complication rate. The same thing sometimes applies to corona as well. When you think, I'm going to beat it, frequently you will find that you can achieve that because your mind doesn't allow the cortisol levels to increase. But if you're stressed about it, I'm always stressed. I mean, people are stressed about something, most likely they will get it. Just that's the way it is. And then you can die at the third stage of stress. And it happens all the time in Japan. People just die out of exhaustion from all the stress they have. And they even have a word for it, karoshi, right? And the effect is that you get a heart attack. So what we said is that there is this adrenaline increase. So you've got a heart attack or a stroke, blood pressure is high, there's a lot of, the pulse is high, and all of that chronically all the time. If you have a blood pressure that is high all the time because of stress, and then also they don't eat well when you're stressed, because we said that it has an effect on the stomach and on the guts. So the end result is that you don't eat well, you have a high blood pressure, you have a high pulse, and boom, the body gives up and you die. Karoshi. Right. So there is 3 stages, as I said, in the stress. By the way, we have it here as well. I mean, how many people have killed themselves? Because they come to a point in the stress where they can't do it anymore. I'm going to talk a little bit about the immune system, and we've talked about it earlier here. As I said, these hormones, the stress that causes these hormones to flood the brain, making the body less able to fight infections. These hormones, especially the cortisone one, the cortisone is also as a drug used to suppress the immune system in certain conditions. So that is increased with stress, and the result is that people are more susceptible to infections and diseases.